It's Nick Bento from my physical assessment video. Patient. It's a table, nothing on here. That's just for my vitals, blank piece of paper. Okay. There's Nick, I'm going to be your nurse. Can you state your name and date of birth?
Allison Bento, 1689.
I confirmed on the wristband. Do you have any allergies to food or medication or anything in the environment like pollen or bees, anything like that?
Nope.
Okay. So we're going to start by taking your vital signs. Put this over here. So 116/72. I'm going to take your pulse. I do this 1 full minute and count respirations as well. So pulse is 80, respiration 16 per minute. Take the temperature, don't have a thermometer, but I'm going to take it temporal, 98.6 degrees Fahrenheit. I check oxygen as well, so I say SpO2 is 99%. Alright, can I have you stand up? Do the Stellan eye exam. So I'm going to have the patient stand 20 feet from the Stellan chart, and I'm going to ask you to read starting from the top line from left to right. Normally I do this with both eyes, then one at a time. I'm just going to do it one at a time. Can you cover your left eye? And start from the top line, left to right.
A, B, C, D, E, F, G, H.
Alright, you good. So she missed more than half of the third line. So as you are, and can you cover your other eye now, your right eye? And same thing.
A, B, C, D, E, F, G, H, I, J.
Okay. Thank you. All right, you can sit back down. So, it's my charting. So blood pressure 116/72 millimeters of mercury. Right arm sitting. Respiratory 16 breaths per minute. Pulse 80 per minute. Temperature 98.6 degrees Fahrenheit. Temporal. SpO2, oxygen 99%. And right eye 20/30. And left eye 20/40. Okay, so I'm going to begin the assessment now. I already confirmed your name. Can you tell me where you are?
I'm at my doctor's office.
All right, can you tell me why you're here today?
Checkup.
And can you tell me what day of the week it is?
Wednesday.
All right, so patient oriented times 4. How would you describe your mood today?
Happy.
Happy? How would you describe it on a day-to-day basis?
Generally happy.
About the same? Okay. Are you in any pain today?
No.
No? Okay. Just going to begin the physical assessment with your eyes. Do you wear glasses at all?
No.
Or contacts?
No.
No? Okay. So I'm going to start by shining the light in your eyes. And we're going to do it twice on each eye. Okay. Alright, and now one more time. Looking at the other eye now. Okay. Alright, so eyes are constricting for direct illumination, and there's also a consensual constriction. Consensual is more sluggish in comparison to the brisk direct constriction. Can you follow my pen light with your eyes only? Alright, keep an eye on it as I bring it closer. Alright, so there's convergence and negative for nystagmus. Alright, so moving on to your ears, do you wear any hearing aids or any hearing devices at all?
No.
No? Okay. So move your hair back. Let's take a look. No skin breakdown. Do you feel any pain?
No.
No pain upon palpation of the mastoid process. And over here, no redness, no skin breakdown. Do you feel any pain?
No.
No? Alright, gonna take a look inside. No drainage, minimal cerumen. Same thing on this side, no drainage, minimal cerumen. Can I have you stand up? Alright, so I'm standing 2 feet behind the patient, and I'm gonna ask you to plug your left ear and repeat the phrase that I whispered to you.
ABC.
Alright, perfect. And again, 2 feet behind the patient. Plug your other ear, please.
1, 2, 3.
Alright, perfect. So now I'm going to do the Romberg test. Can you put your feet straight together with your arms at your side and just stare straight ahead? Now we do this for 20 seconds. And can you close your eyes and continue doing that? Alright, so there's very minimal swaying. Balance is good. Alright, so we're going to assess your gait. Can you just stare straight ahead and walk across the room? And can you come back, walking heel to toe? Alright, perfect. So gait is steady. Alright, you can take a seat again. Thank you. Alright, so I'm going to assess your cranial nerve 1. Can you, I have a scent in this cup here. Can you plug your right near your right nostril? Close your eyes and tell me what you smell.
Mint.
Mint, okay. And I'm going to grab a different cup. Can you close your eyes, plug your left nostril, and tell me what you smell?
Coffee.
Coffee. All right, perfect. And I'm going to just take a look inside your nose. Okay. Yeah, okay. All right, pink nasal mucosa, no drainage, no bleeding. All right. So can you tell me, do you wear any dentures at all?
No.
No? Excuse me. Okay, can you open up your mouth? Oral mucosa, pink and moist, tongue pink and moist. Can you raise up your tongue? Frenulum is midline. Can you stick out your tongue? Can you move it to your left and to your right? Okay. And we've got a tongue blade here. Can you open up your mouth again and say ah? All right, tonsils grade 2. Can you do it one more time? All right. Uvula midline, uvula and soft palate rise when the patient says ah. Okay. And I've got a glass of water here. I'm going to ask you to just take a sip so I can assess your swallowing. Okay. And I'm going to feel your throat while you swallow now. All right, the thyroid, non-palpable. Okay, thanks. All right, so trachea is midline. I'm just gonna move your hair a little bit so I can see your neck better. Thanks. Can I have you move? Can you turn your head to your left? And patient would be at a 45-degree angle. Okay, and to your other side. All right, no jugular vein distension. All right, just gonna check your range of motion. So, can you just one more time turn your head completely to your left and then completely to your right? Okay. Can you put your left ear to your left shoulder and then your right ear to your right shoulder? Okay. Perfect. So I'm going to just feel your pulse. All right. Carotids one at a time. All right, carotids +2 bilateral. Listening with the bell, just going to listen to your carotid artery. And just hold your breath for a second. And just hold your breath for a second one more time. All right, so no bruits. All right, so I'm going to feel your lymph nodes now. Okay. Preauricular, postauricular, occipital at the base of the skull, just little circles. All right, posterior cervical, anterior cervical, submandibular, submental, supraclavicular, infraclavicular. Okay, check skin turgor underneath clavicle while I'm here. Skin turgor is non-tenting, returns right away. Okay, good. And gonna be moving on now to your arms. So can you stick your arms straight out to your side? And can you rotate them? All right, good. And can I ask you to do that one more time? I'm just gonna do a couple coordination tests. So your arms straight out. And with your right index finger, can you touch your nose? And then with your left index finger, can you touch your nose? And then can you do it with your eyes closed? All right, perfect. And with your hands on your lap like that, can you rotate them quickly? Like up and down like that? All right, good. And with your, we're gonna do like the finger to thumb test. So can you rapidly touch each of your fingers to your thumb with both hands? All right, perfect. And I'm gonna grab my cotton ball to test your facial nerve. And can you tell me, do you feel this on your arm?
Yes.
All right, and every time, and I'm gonna ask you to close your eyes, and when I touch your face, tell me now when you feel it.
Now. Now. Now.
All right, perfect, thanks. Okay, I'm gonna check your pulses on your arms. Brachial pulse, 2+ bilateral. Radial pulse, +2 bilateral. And I'm gonna check the skin all the way down. And I'm feeling for any edema, anything like that. No edema, no lesions, no rashes. Checking temperature, back of my hands, and temperature is even, warm throughout, skin is dry. Okay, I'm gonna check your, can I see your finger? Check your capillary refill. Okay, and your other hand. All right, so both hands, wrist, capillary refill, under 2 seconds. And I'm gonna test your strength. So can you push up on my palms? Okay, can you push down? All right, can you squeeze my fingers? All right, good. I'm gonna check your reflexes. So, clean off, hammer hair, sanitize that. Okay, so I'm gonna check your tricep reflex and just relax. Okay, and your bicep reflex. And again, just bend it a little bit. All right, perfect. It's a tendon. Okay. And I'm going to ask you to make a fist so I can find the brachioradialis tendon. Okay. And you can relax now. And hit my thumb. Okay. And same thing over here. So tricep tendon. Okay. And your bicep. Okay. And again, can you make a fist? Feel. All right. And you can relax now. All right. Perfect. And while I'm at it, I'm going to ask you to, I'm just going to do the patellar reflex as well. So ideally, I would have the patient dangling her legs over the side of a bed. I'm just going to support the leg on my hand and just completely relax. Okay. And same thing on the other side. All right, just relax. Okay. All right, so we're done with the reflex hammer. Okay, so I'm going to ask you, do you smoke at all?
No.
Do you have any respiratory problems such as asthma or COPD, anything like that?
No.
Do you have any cardiac issues, any heart problems, any like high blood pressure or chronic heart failure, anything like that?
No.
No? Okay. So I'm going to listen. I'm going to begin with your heart sounds and then do the lungs. Okay. Aortic, I'm at the second intercostal space, right sternal margin, and S2 louder than S1. All right, pulmonic, left sternal margin, second intercostal space, S2 louder than S1. Erb's point, third intercostal space, left sternal margin, S1 equal to S2. I'm going to listen with my both diaphragm and the bell. Tricuspid, S1 louder than S2, left sternal border, fourth intercostal space. And move on to mitral, fifth intercostal space, left midclavicular line. S1 louder than S2. Can I have you lean forward? It's the apical pulse. I would listen for 1 full minute. Rate is 80 beats per minute. Okay? So now I'm going to listen to the lung sound. So each time you feel the stethoscope press you, can you take a deep breath in and out? Okay? Move your arm a little bit. Thanks. Okay. That's 6 in the front, last to a lateral. And can I have you lift your right arm? I'm going to listen to the right lobe. 4th to 6th intercostal space, mid axillary line. And deep breath in and out. Okay. And just for the camera, can I have you stand up and turn around? All right, so I'm going to check a respiratory expansion and then listen on the posterior. So can you take a deep breath in and out? All right, so expansion was equal on both lungs. And same thing every time I touch the stethoscope, take a deep breath in and out, please. Okay, you can sit back down. some no adventitious breath sounds, clear throughout, unlabored breathing pattern. Okay? And ideally should be obviously in a gown, and I would check all the skin on the back, and skin is intact, no lesions, no scarring, anything like that. Temperature is warm and even throughout. And same thing, anterior I would check, and for the upper part, symmetrical, muscles are symmetrical, even temperature throughout, skin is dry, and no scarring or lesions. All right, so I'm going to move on to your abdomen. Can I ask you, when was your last bowel movement?
This morning,
This morning, okay. How often do you have bowel movement?
about once a day.
Once a day? All right, perfect. How would you describe like the consistency of it? Was it like a watery or formed?
Formed.
Formed, okay. How would you describe the color?
Brown.
Brown, okay. So for your urination, do you ever experience pain while urinating?
No.
No? How would you describe the color?
Light yellow.
Light yellow, okay. Do you have any problems with frequency or urgency, like you have to kind of just like run to the bathroom all the time?
No.
Or, okay, perfect. Okay, so I'm going to ask you to lift up your shirt. I'm going to begin by inspecting your abdomen. Okay, so abdomen is symmetrical, no scarring, no lesions, no redness, color is expected. All right, so I'm going to auscultate now. I would listen 1 full minute in each quadrant. Bowel sounds are normal, active, at about 10 gurgles and sounds per quadrant per minute. Normal is 5 to 30. Okay? So I'm going to go ahead and percuss and palpate your abdomen. Okay? All right, so tympani throughout, and I'm going to listen now. I'm sorry. I'm going to palpate now. All right, so I'm going to palpate lightly and then deeply, so please tell me if you feel any tenderness or pain. Do you feel any pain?
No.
Okay, I'm just going to go a little bit deeper now, about 2 to 4 centimeters. Any pain or tenderness?
No.
No? Okay, you can lower your shirt now. No mass is felt, all normal findings. All right, so do you use any assistive devices to help you walk?
No.
No? Okay, so in general, would you say that you have a good gait, you don't have any pain or anything when walking?
No.
Okay, perfect. So I'm going to go ahead and feel your pulses first. Sure, I believe the video can see. All right, so behind the knee, the popliteal pulse. 2 plus bilateral. Behind the ankle, posterior tibialis. 2 plus bilateral. Dorsalis pedis is plus 2 bilateral. Okay, I'm just going to feel down your legs, feeling for any edema or difference in temperature, anything like that. Checking there's no edema, no scarring, no lesions. Temperature is even throughout, skin is dry. Okay, so I'm going to ask you to, I'm just going to adjust the camera, make sure that the feet are visible. Okay, I'm going to ask you to, with your feet, can you rotate your ankles inward? Can you rotate them outward? Okay, and can you lift your feet both straight up? And then down, okay, so up and down, so that's dorsiflex and plantar flex. Can we do it with this foot as well? All right, perfect. And can you kind of kick your knees straight out? Perfect, and with your other leg. All right, can you stand up? And I ask you to put your leg one at a time, just straight to the side and back in. All right, full range of motion. That's it for my assessment right now. Do you have any questions for me?
Nope.
All right, perfect.